Morning everybody, Eric Chaconis here for PT on Ice, and today we're going to talk about manual resistance techniques and how we can improve proprioception, control, activation, and timing through rehab with this technique. So what we're talking about is having the patient perform a movement, right? So maybe it's just bringing the scapula back into retraction and applying resistance to that movement, right? So I can say tap here, go ahead and resist. That's a concentric movement, right? I could do it isometrically where I have her bring it on back, hold there, don't let me move it, and I can change directions, right? Almost like a rhythmic stabilization type of a thing. I could work both opposite directions or opposing muscle groups, so I could say go ahead and pull it on back, now bring forward, pull it on back, bring it forward. I could focus just on an eccentric phase, right? So bring it on back, hold it there, I'm going to bring you forward, let me move you slowly, right? And then I can also couple it with combined movements or movements down the limb. So I could say, and bring your shoulder up and out like that. And as I have her hold there, I can resist there and concurrently resist the scapula for different forms of perturbation. Towards the end, I'll show you a whole bunch of techniques and different options and stuff like that. But let's kind of dissect this for a second and really look at what are all the benefits that can occur and what's really happening when we do this. So first of all, it's a manual technique, right? So it's not a passive, it's not entirely passive, so maybe a little different in that regard. There's an active aspect to it. But when we perform this movement, we're also getting kind of all those hypoalgesic neurophysiological effects of manual therapy, the benefits of therapeutic touch, and all of kind of the literature and mechanisms of manual therapy that you can think of, right? Some of those do apply in this case. And so we certainly want to leverage that, utilize that to our ability. So if we're having the patient perform an exercise while concurrently having some type of a hands-on approach, there's a lot of benefit to that, a lot of reasons to integrate that. The one thing I would just say is, it has to be therapeutic in nature. There's a finesse, a level of finesse that needs to occur. Soft hands, light resistance oftentimes. We're usually dosing this. Typically we're in an early phase of rehab and we have sort of a light resistance, high dosing parameter. And so one of the things that we usually will in the extremity course will oftentimes be going around giving feedback, and usually people are a little too heavy-handed. They're too firm. They're too kind of they're not soft enough in their handling. So handling with skill and finesse and a gentle nature is important. And you can always ramp up. You can always add force, right? The other thing is there's a continuous assessment that occurs while we're doing this. So if I can feel, go ahead and pull it on back, I can feel a specific point in the range or a specific direction that is challenging for the patient that they're not able to control. Maybe I feel fatigue occurring at a certain point in the range or at a certain point in the dosing parameter. Then I can kind of take that information, right, and integrate that into the assessment, and I can treat that. I can focus on that. And so there's a lot of benefit to the continuous assessment, listening through your hands and being able to interpret changes in direction and issues that you're seeing. Timing and activation is also important. Traditionally, with most of our exercises, right, they are sort of steady cadence, steady tempo, and we're not really changing timing and direction and activation of different muscle groups as much as we'd like. So with this technique, you can certainly do that, right? I can quickly change directions, right? And I can change speed to try to develop control in different movements and different activation patterns, and I can feel that from an assessment standpoint. And the last thing I'll mention is proprioception. So I've talked about proprioception before. If you go back maybe 6 months ago, we did one on joint position sense and looking at the patient's ability to sense where the joint is in space using your inclinometer app on your phone to try to determine that, and that's a great test for joint position sense. What you can do here is look at force sense, right? So force sense is going to be your ability to hold and resist at an appropriate level of load, right? So if she's holding here, I can kind of pull, and if she's overshooting, which people will often do when they have pain or injury, if she's overshooting, then I'm going to feel her kind of move back too far. She's undershooting, or she's weak, or she's unable to apply the appropriate amount of resistance, then I'll feel that, and she'll kind of let go there, so that'll be problematic there. So A lot of benefits to this technique. Let me show you some options that you got here. So first and foremost, I really like to couple, right, periscapular, if we're working the shoulder here, periscapular training with cuff training. So she's coming back here, and I'm going to put a load in your hand. So if I have her hold a weight, right, she's got to resist that for external rotator right there. I'm going to kind of resist as she's applying that. And I can work down the limb, work for extension, tap that muscle, get it control there, right, here. Working distally like that. If we go to supine, I'll show you kind of some of my sort of go-tos in this position. So she might already be in supine, and I've been working manual techniques, manual therapy, working distraction, working posterior glides, anterior glides in that position. And then what I can do is I can kind of apply almost a traction force. So I'm going to pull, resist me, don't let me move, don't let me move, keep it there. And then I'm changing direction, right, with that traction force. So getting that kind of nice solid control and proprioception while I'm applying resistance. And then changing direction by taking your hands off in each direction and having her do that. And then work that distally. Work proximal to distal, right? Distal to proximal. Now she's getting input all up and down the entire limb. She's able to interpret that. Her nervous system's able to interpret that and try to control for it, right? And if I sense one movement, there's just timing is off there, she isn't resisting me quick enough in that direction, then I can kind of tee off on that and really work on that. So that's a kind of I can apply traction and then do the perturbation. The other opposite way would be punch up, right? Go ahead and resist. Now I'm going to apply kind of a compressive force, almost straight down, right? And so I'm pushing down, getting a lot of serratus anterior engagement, but same deal. I'm going to go ahead and resist. Don't let me move you. Perfect, right? So sky's the limit. You can get so creative with these and do so many different, there's so many different options, things you can do. For the quad, I'll just show you kind of another one that I like to do. All right, so early on, we're focusing on some quad isolation work, like with a straight leg raise or something like that. And what I want to do is, as I get that quad to fire, go ahead and raise it on up. I want to get a concurrent hip control, right? So I can work ab and adduction while she's sustaining the straight leg raise. I really like this. If I find a point in the range that they tend to struggle a little bit, she's getting a lag, she's not locking out, I can correct for it, fire, 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 and then I'll work resistance down there. Coupling it with rotation, so I can put a rotary force through the distal limb, through the foot, like that, right? And then the timing, the antagonist timing thing. So if she's pushing up, go ahead and resist, resist, resist. Now push back, good. Up, back, back. So you're really working her hip in all directions with a concurrent quad contraction with that one right there. All right, so try those. Really, any exercise you're utilizing, you can add manual resistance, change your direction, different changes in timing, and make it a manual resistance exercise. So have a great, well, let me get to comments. PT School 101, that's... I think that what oftentimes happens is we will we know the principles, right? But we're not really necessarily applying them to the best of our abilities. So sometimes you take concepts that you've learned in PT school, but you're kind of enhancing them with a clinical application, right? Just based on sort of a lot of the more common concepts or ideas. So like force sense, for instance, right? That's an issue of proprioception that might not always be discussed when we talk about manual resistance exercise and stuff like that. And so that assessment piece, getting the timing and activation down, all that sort of stuff. So have a great day, everybody.